It spreads so easily. Anyone can get it. It may be too late to stop me. No protection, no warning. He said it could be airborne. Is there a cure?
There is a band once held a parent who worked tirelessly until tuberculosis stole their breath in. The same bed was passed by a group of friends, unaware that misunderstanding HIV/AIDS can hurt more than the virus. A frail child once lay, dehydrated and weak, gripped by the pain of gastroenteritis. When the blood water rose, the bed followed, a light struck by leptospirosis, cough of guard by the unseen. Not long ago, a vibrant student lay free, silent to soup by meningitis.
One bed, 5 faces, 5 stories. Not just a disease, but urgent lessons we can no longer ignore. They are closer than you think.
Tuberculosis is an infectious disease caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs, but it can also spread to other parts of the body such as the kidneys, spine, and brain. TB is transmitted through the air when a person with active TB disease coughs, speaks, or sings, releasing bacteria into the air.
Persistent cough, night sweat, weight loss. TB often begins quietly and spreads without a warning.
You're positive for TB, but it's treatable. Well, it's not true for food, but you're coughing, that's your spread. So careful, and it's gonna have it very early. So
Treating tuberculosis takes time, but it works. With proper medication taken every day for at least 6 months, TB can be cured.
Know the signs? Get tested. Finish your treatment. Save life.
Let us talk about something that affects millions every year. Gastroenteritis. What is it? What causes it? What are the symptoms and how can it be treated? Let's find out together.
Dude, come here. You should try this bread. It tastes good.
I haven't washed my hands.
It's okay. It's so easy about it.
Gastroenteritis is commonly caused by viruses like rotavirus, norovirus, adenovirus, and astrovirus, as well as E. coli and salmonella. These germs spread through dirty food, contaminated water, or unwashed hands.
Miguel, what's the problem?
My stomach hurts. I feel dizzy and nauseous.
Symptoms of gastroenteritis include abdominal pain, diarrhea, nausea, vomiting, fever, and signs of dehydration. These can appear within hours or a day after infection.
Wait, Mom. I really need to go to the CR.
Mr. Ramos? Yes. Mr. Ramos, we're filling up your checkup. According to my observation, we have medication for viral gastroenteritis and we have intermediate in the components of food, hydration, and just being alert. Treatment for gastroenteritis focuses on staying hydrated with oral rehydration solution or IV fluids in severe cases. Rest and light meals like bananas, rice, applesauce, and toast are recommended. Most viral cases resolve in few days without medication. Seek medical care if symptoms persist or include high fever, blood in stool, or sign of severe dehydration. Bacterial or parasitic cases may need specific medication.
Always wash your hands before eating and after using the bathroom.
Yeah, I'll remember to wash my hands before eating breakfast again.
Preventing gastroenteritis quick fix. First, wash hands with soap before eating, after using the toilet, and after handling raw food. Second, drink safe water, boiled, filtered, or bottled. Third, eat well-cooked food. Avoid undercooked meat and eggs. Next, skip raw street food unless hygiene is clearly maintained. And lastly, handle food safely at home. Clean surfaces, separate raw, cooked items, refrigerate leftovers, and wash produce well. A reminder from our story. First, clean your hands.
Make sure your food is safe.
Drink clean water.
And don't forget to always be careful.
Gastroenteritis may be common, but with clean habits, smart choices, and early care, we can prevent it.
Safety is in your hands. As long as you're clean, you're safe. All day, every day.
There's so much we think we know about HIV, but are we sure it's true? Let's talk real. Let's clear the myths. Let's hear the truth. And it starts with real stories.
We'll just wait for the doc.
I'm so nervous. What if I have it?
Knowing is better than guessing. It's the first step in knowing your health and protecting it.
I thought I wouldn't be affected.
Well, anyone can have HIV. But rest assured that the thing is, there is treatment. Mark, there is hope.
When I was diagnosed with HIV, I was terrified. When I first found out I was HIV positive, I was overwhelmed with fear. I heard so many things, but nothing really prepared me for what came next. I thought my life was over, but my doctor explained that with the right I can live a healthy life. At first, I didn't feel much. I had some fatigue, which I just thought was from stress. But then, I started noticing things like frequent headaches, unexplained weight loss, and night sweats. My immune system felt weaker, and I get sick more often. It wasn't until I had a bad cold that wouldn't go away that I realized something wasn't right. I started on antiretroviral therapy, and honestly, the difference was immediate. The first 3 months were tough. I had to get used to taking pills every day, but the side effects were not as bad as I feared.
HIV is a virus that attacks the immune system, so with early detection and proper treatment, people with HIV can live long, healthy lives. It spreads through unprotected sex, sharing needles, and from mother to child during birth, not from hugging, kissing, or sharing food. Treatment, yes?
I introduce you to antiretroviral therapy. Antiretroviral therapy, or ART, is a treatment for HIV that uses a combination of medicines to reduce the virus in the body, boost the immune system, and prevent the progression to AIDS. It helps people with HIV live longer, healthier lives, and reduces the risk of transmitting virus to others.
And prevention, use condoms. Get tested regularly, and there's even PrEP, a pill that helps protect you.
You are not alone. There are many of you who are victimized by the unforeseen sickness without any awareness. But with numbers, this should not be burden to oneself. Paolo, I'm thirsty. Do you have water?
Yeah, I have water. It's in my backpack.
Wow, it's so cold.
Meningitis is an inflammation of the protective membrane covering the brain and spinal cord. Often caused by infections from viruses, bacteria, or fungi, it can spread through close contact like coughing, sneezing, or sharing utensils and drinks.
Say present if you are here. Paulo? Paulo, are you okay?
My head hurts. My neck hurts. So much.
Symptoms of meningitis may include headache, fever, stiffness, nausea, sensitivity to light and confusion. In young children, symptoms may be higher as well, and irritability, drowsiness, or low stomach, cold body.
Sir, sit down there, sir. Morning, doc. Good morning. We need to run a test. Meningitis can be serious. If it's bacteria, immediate antibiotic is needed.
Early diagnosis and treatment are crucial. Bacterial meningitis can be life-threatening, but timely antibiotic treatment can save lives. Viral meningitis is usually milder and resolves with supportive care.
Hey, get a doctor. Thank you.
Guys! Doctor! Doctor! Meningitis is real! Oh my god, yes! That's so ill! And make sure you're vaccinated. We have lots of vaccines to prevent meningitis! Meningitis! Ew!
Prevention tips. Take hand wash kahapon. Avoid sharing personal items. Cover your mouth when traveling and sneezing. Stay home when feeling sick and get vaccinated.
Meningitis is no joke. It's true, but you can prevent it. Yes, you do start with habits. Safe and clean. Stay informed. Keep your routine. Act with care and don't delay. Protect yourself in every way. With knowledge, safety is in your hand. Stay alert. Make your stand. Avoid meningo. Take command.
Come on, more. We used to walk barefoot on blood, right?
Yeah, come, let's go.
Leptospirosis begins with the blood. A bacteria called Leptospira lives in water contaminated by animal urine, especially from rats. It enters through cuts, open wounds, ties, even unbroken skin after long exposure. Sometimes, all it takes is one careless step. Leptospira, silent, unseen, sleeps beneath the skin, no warning, no sound.
Hey, what happened?
My body aches. My eyes are red.
That's not normal. You're burning up. Let's go to the clinic now.
At first, it feels like the flu, fever, chills, muscle aches, red eyes, vomiting, and diarrhea. These signs usually show 5 to 14 days after exposure. But beneath the surface, something worse may already be happening. Kidney failure, liver damage, and even meningitis. Fever, chills, red eyes, muscle pain. It pretends to be simple, but inside, the body is fighting for its life.
Don't get to the hydration and get there. Press on the sir. Hey, Carlo. Given your results, this would be not a priority. Good thing came early. We'll start you on the oxygen cycling right away.
Leptospirosis can be treated if caught early. Doxycycline or penicillin are the first line of defense. Early treatment gives the body a chance to fight back, but delay it and the infection may turn deadly, attacking vital organs before health arrives.
We should have warned you not to walk barefoot on the flood. We didn't think it would be this serious.
Yeah, at least we know now. I should wear boots next time. Boots before bravery. There's no small act in prevention, but a small reminder could save us.
Leptospirosis hides in floodwaters, but awareness, action, and hygiene give us the upper hand. From one step into danger to one step toward prevention. This battle starts beneath the skin, but we fight back with knowledge, with care, one step at a time.
5 stories that could be anyone. Each one a reminder of what we often ignore.
Tuberculosis, HIV, gastroenteritis, leptospirosis, meningitis.
They don't ask who you are. They come quietly, and they use scars. Misinformation makes them stronger. And awareness brings protection.
But truth can save lives.
Let's listen. Let's learn. Let's act.